started here. So thank you everybody for joining us today. For those of you who are joining us for the first time and may not be familiar with I-Chords or knowledge cafes, I-Chords is a community of practice that centers around the social and behavioral sciences in the field of neglected tropical diseases. And its purpose is to bring people in this field together to learn and collaborate with each other. And one way we do this is through our knowledge cafes, which help us hear from experts in the field and to hold a discussion on the concepts shared and learned. And during the session, please feel free to put any comments or questions you have in the chat, and we will address them in the discussion portion of the session, which takes place following our speaker's presentation. So our session today aims to speak to the ethical, scientific, and procedural considerations for data sharing in social research. Our first speaker this morning is Sarah Sullivan. Sarah Sullivan is the Associate Director of Research Data at the NTD Support Center, where she is responsible for the development and management of NTD-SC's Open Access Research Data Portal. She also draws upon her experience utilizing complex statistical techniques, including clinical trial analysis, mixture modeling, and spatio-temporal analysis to support operational research projects. Sarah earned her Master's of Science in Public Health from Emory University with a focus on biostatistics. The session will be moderated by Dr. Alison Krentel, who is an associate professor in the School of Epidemiology and Public Health at the University of Ottawa and a scientist at Bruyère Research Institute. So thank you to you both for taking the time to share your knowledge and expertise with us today. And I'll pass it over to Sarah.
Maganga.
Rachel, for that introduction, I'm going to share my screen with you. And we'll get going. So as Rachel mentioned, I'll be talking today about the secondary data use in social research. So a quick overview of my presentation. I'll first start by talking about what secondary data is. I'll talk about why research data sharing is encouraged, data sharing standards and requirements, as well as considerations in secondary research analysis. So thinking both about how data is shared and then once it's been shared, how it's used. To start off, what is secondary data? Secondary data is a data set that's being used either for a purpose other than the original aim of data collection, or by a person who was not involved in the design or collection of data. And I think for the purpose of this session, we're going to be talking more about when you're using data that you aren't the one who collected it, you weren't involved in the design and collection, and you're using it from a secondary source. And there are a whole variety of potential secondary data sources, and they vary in terms of their purpose and with that purpose, how we can use them. So kind of on a large scale, we have census or demographic data. It's often collected by government, and it tells us and is intended to be used for a whole variety of purposes. Some of it is as simple as counting the number of people, but it's also about looking at where those people are and different characteristics about them. And the intent is for it to be used widely. Then kind of getting a little bit more narrow, we have administrative data, and this is often about healthcare or education collected to help these programs run, but can also be interesting from a research perspective. How much access to care does a person in this place have? What is the median level of education achieved? Are questions that are really important for when you're running those systems, but they can also be used by other researchers. And then finally, and the focus of today's talk, we're going to be talking about the results of either prior surveys or research studies. And these are an even narrower focus usually. There's going to be more limited data, and that data was collected with specific research questions in mind. And so thinking about how we use that data, it's really important to have the context of why that was collected and any potential constraints about how that was collected when we're then trying to use that for potentially a different purpose. So thinking about secondary data use, specifically in NTD, there are a lot of examples of secondary data use initiatives and data sharing initiatives. These are used for mapping prevalence, looking at the implementation of interventions, got disease burden estimates, sometimes clinical research data, and they can either be disease specific or cross-cutting. So I think one that many people in the audience may be familiar with is the Aspen portal, which is a data portal that shares the both the sometimes prevalence information about NTDs in specific places, as well as how MDA or other interventions are being rolled out, and that is being used in a lot of ways. But on the other hand, when we're thinking specifically about research data, in particular data from qualitative studies, the avenues for sharing aren't as direct, either for sharing that data or for using data that is shared. So it's a little bit more complicated with this type of research, but we also want to think about why is it being encouraged, and why should you either consider sharing your data or consider utilizing secondary data. Some of the factors that are driving this are an increasing knowledge about the power of data across many sectors, not just health, but we understand that data has a lot of power and can give us a lot of information. There is also a publication bias in health research where about half the studies that are conducted are not necessarily published in journals and therefore don't contribute to the scientific literature. So there is a lot of information that has been collected that hasn't necessarily seen the light of day. We know that resources are limited, and we want to maximize those potentially limited resources. And then there's also kind of a human rights perspective to this, where the Universal Declaration of Human Rights states that everyone has a right to share in scientific advancement and its benefits, whether that be as a participant who has been a part of research, or as someone who is receiving, say, a new intervention as a result of research that's been conducted. So in this context, we have some factors driving this. There are a couple of movements and frameworks that I want to talk about, and these are open access and fair data. Open access is probably something that lots of y'all are familiar with and probably excited about. I know I am very excited when I see that an article is published open access, because it's a movement to grant free and open online access to academic information. And usually we think of this in the context of publications, but it's actually not only about the publications being open and accessible, but also the data that underlies them being open and accessible. So because of this, many journals, particularly open access journals, require a data availability statement that details how you can get to data. And in terms of how you can get to data, there are lots of ways that data can be shared. But to make sure that data sharing can actually serve the benefits that are driving us to share data, we want to make sure that data is findable, accessible, interoperable, and reusable, also known as fair. So what this means is, if you're looking for studies on a specific topic, you can find those studies. If you're trying to then access the data, there is a path through which you can be given access to that data. Interoperable means that you can utilize the format that the data is in, so it's not in some proprietary system that you can't pay for and therefore don't have access to. And then reusable is, you need a lot of context and a lot of information in order to actually reuse that data. It can't just be a spreadsheet or a list of something. The context and the protocol, all of those things of how the data was collected is really important. So some of the potential benefits really of then using secondary data that's been shared is that we can analyze unused data with 50% not available in the scientific record. A secondary analysis may be the first time that the results of the data are available to the scientific community. We can think about cost efficacy, where secondary analysis can provide cost-effective insights when you don't have the data collection isn't feasible, either because it's not feasible to reach participants or because the cost would be exorbitant. Another area that's important in thinking about secondary data use is accessibility for students. Analyzing existing data can allow students who don't have either the skills or the resources to conduct data collection to conduct research. So keeping in mind all of those lovely benefits and great things about sharing data, there are a lot of standards and sometimes requirements around sharing data that I want to talk about now. So some key considerations of data sharing are not dissimilar from considerations that we have to make for any research study. We want to make sure that we take into account first and foremost our study participant protections, particularly privacy and confidentiality. We also want to think about ownership and authorship, who owns this data and who gets credit for collecting this data. We want to make sure that, as in any scientific research, data is used to its fullest and with appropriate context. As I talked about a couple slides ago, we're going to share data. We want to make sure it's done in a fair way so that it is actually usable by others. And then we want to think about if sharing is required potentially for publication. So I'll start by delving in a bit on protecting study participants. And I think it's important to note that protecting study participants starts at the very beginning of the study. Data sharing isn't something that you can just do right at the end. It's something that should be built in from the start. And the really key first step there is that consent, as with any research, is really important. And when you're going to be sharing data, consent is important both for study activities and for sharing data. So it's understanding that this data, we're collecting this data for this specific purpose, and then saying what other purposes could this data be shared for and who could it be shared with. Then we also want to protect confidentiality. And this comes more in the sharing end of the spectrum, but after the data has been collected. And to protect confidentiality, we have kind of two paths. Usually these are utilizing de-identification or including ethical oversight. So for de-identification, this usually means removal of or masking of a few different things. It can be identifying questionnaire data, things like date of birth or your national ID number, an email address. Precise geographical location can tell if you know where exactly someone is, you know who they are. Images, including faces, are identifiable, and so they will need to be removed. And something we don't run across very much in NTD work, but there's also the case of genetic data, which is an identifiable piece of data. So it is feasible to protect participants' confidentiality when you want to share data. You may be able to remove or mask these elements. However, it's also important to understand that it's not always possible because of our research questions and our research context to do a full de-identification. So for example, if your research question is, I want to understand the spatial relationships of cases of a disease within a village, it will be necessary to understand the exact geographic locations of all of these cases. And so you can't fully de-identify. And when full de-identification is not possible, it's really important to include ethical oversight. This can be done via things like data sharing agreements and often involves ethical bodies such as institutional review boards or IRBs. It's also important to protect researchers, both the primary and secondary researchers who are intending to do great things with this data, but there needs to be context in which you can. So the context is really vital. Raw data sets are important, but you need all of that context to perform a secondary analysis. Things like protocols, how is this data collected? What were the methodologies? How were people consented? What specific questions were they asked? Not just the 10-character long variable name. That context is really important if a secondary user wants to actually be able to understand the data. It's also important to give credit and to ensure that people who collected the data are given credit. Communication is another key thing that is particularly important in the context of qualitative research, because open dialogue with the original researchers can provide additional context for a secondary researcher. And it can also allow the original researcher to investigate their data from a different perspective. And then finally, we have to also protect researchers, we have legal frameworks. We have things like data sharing agreements, data use agreements, which are kind of similar. Data transfer agreements is another phrase, and sometimes memorandums of understanding serve this purpose as well. But these four elements are key to protecting both our primary and our secondary researchers when data sharing and secondary data is happening. There are some global and national standards for data sharing. I would break it down to say that there is kind of broad international guidance, some of it from WHO, and there's a specific WHO policy about how WHO shares data collected by its own researchers and any researchers that it funds, that I think can be a great starting point for anyone who wants to learn about this, especially because it includes guidance about how to create your own data sharing plan if you're looking to share your data. Next up, there are kind of multinational frameworks. These specifically tend to involve moving data between countries. And a good example of this is the GDPR regulation, which is utilized in the European Union. And then I think one of the most central, but sometimes the most difficult, is what the national regulations on data storing and storage are. Data sharing and storage are. And so countries often have very specific rules about how data can be shared, specifically health and research data. And so you have kind of a variety of frameworks that may intersect to lead you along your data sharing or data use path. I also want to talk about the requirements for data sharing. Some elements that are involved in research require that the data that comes out of that research be shared. And this typically falls into three categories: funders, journals, and institutions. So people who fund research or institutions who fund research, as a condition of paying for that research, may require that the data collected be shared. A good example of this is the Bill and Melinda Gates Foundation has a broad data sharing policy. The World Health Organization, as I talked before, has this policy and framework. The policy only applies to the WHO itself, but the framework is something that they welcome other people to use. And then sometimes governments, if they're paying for research, will require that the data be shared. On the other side, we've got journals. Particularly open access journals will often require data sharing in order for a manuscript to be published. And some key examples here for this community are PLOS NTD does require data sharing as a requirement for your manuscript to be published. And some other big journals are the BMC journals and the Lancet journals that require some level of data sharing. You can also have cases where an institution that you're a part of, a research institution, be that a university or a center, may maintain a repository for data, and they can govern how data is managed and then shared outside of that institution. Next up, we have specific data protection rules. And these are usually, as I mentioned a couple slides ago, they're often country-specific and sometimes even subnational data protection laws that can vary broadly, or sometimes they are on the books, and sometimes there are not specific laws that govern this, but they really reflect the location's cultural context. It's important to know the data sharing rules that you are subject to in terms of data collection, where your data is stored, and how your data is shared. So there might be one set of rules about how data is collected in a specific place, but if it's being stored in another place, there may be another set of rules. And if you intend to share it to a third place, you may be subject to another set of rules. So it's important to know kind of what is the specific government regulations and the norms in the place where this data was collected. So unfortunately, I don't have a blanket policy to share with you all that will definitely be safe in every situation, but knowing your local regulations is really vital for that. So I've talked a lot up till now about sharing secondary data, but I want to now focus on when you're conducting secondary data analysis. You are the person who didn't collect this data and you want to conduct analysis based on someone else's data. So we have a lot of stakeholders in this. It's not just our secondary users when we're thinking about secondary use, that are involved, we also have the people who participated in the study, the researchers who collected the data, the countries where data was collected, and the organizations who funded the research. And while there are benefits, there are also challenges. We want to maximize the impact of research. Sharing data can increase transparency and trust, both between scientific researchers and in the scientific community, and from the public, their trust in the scientific community. And we preserve the scientific record with it. But it can be challenging. We need to take confidentiality concerns seriously. There's a potential for misinterpretation of data, especially if data is not given proper context. And there can be complicated rules and guidelines. So looking specifically at social research, there's often a blend of data that's collected and used. We have quantitative, qualitative, and mixed methods research, and they may require different methods to conduct a secondary data analysis. Specifically, the personal and individual nature of qualitative research can make data difficult or time-consuming to de-identify, or it may not be possible to separate that data from its context. And so having that context being so important, it can be difficult to ensure that, especially in the context of de-identification. So with that, I'm going to hand it over to Dr. Alison Krentel, who's going to talk more about the specific concerns when we're talking about qualitative and social data in data sharing in secondary data.
Thanks, Sarah. Thanks for setting the stage for this part really nicely. I'm just going to offer a few comments to add to what Sarah said, just within the context of qualitative research in particular. And I'm not going to share any slides because it's just sort of a little bit of just some commentary for consideration, and then we can open up into discussion. So I think when we talk about qualitative research, I think one of the important things to establish is just the very different relationship that qualitative researchers have with their participants than a survey-based interviewer will. So when you think about particularly like in anthropological research, when you think about in-depth interviews, or if you're doing a cohort where you're following a group of people and interviewing them, over a period of time and developing a relationship, it has a very different feel than you do if you go in and deliver a survey to someone. And so so it's important to just establish just that different relationship, and also how the researcher, then their perspective becomes really part of the data collection process as it goes forward. Sarah mentioned a lot about context, and I think within qualitative data, there's this what Sarah Irwin calls contextual embeddedness of data, and I'll post her paper for everyone to see. But when we talk about qualitative research, we cannot really look at it without considering the context in which it was conducted. And so sometimes when we consider secondary analysis of qualitative data, it is removed from that culture and context where the data was collected. And so how do we bear that in mind in a secondary analysis? Also, when we think about the increasing movement towards community engagement and community empowerment in research and bottom up or localization, the different terms that are used, some of the research methods lean towards more participatory methods. And so how do we bear in mind also in secondary analysis the role of community and their perspective in that? So although data is embedded in the context, as I've mentioned, but the context is also embedded in the primary data. And that's also important to consider if you're thinking about doing secondary analysis of qualitative data. So I'll just say that again, data is embedded in the context, but context is also embedded in the primary data. And that may be, for example, the kind of research design, the disciplinary or the methodological assumptions that you make as you create the study. Just in terms of some practical considerations, Sarah mentioned, and I think it's so important, the protection of data participants begins at the very beginning of the research. When we think about sharing transcripts, for example, the effort that needs to be made to ensure that they are completely de-identified, that no one can be identified through reading of a transcript. And sometimes that's not possible. So when you think about interviewing a nurse from region X in this particular facility, there may only be one nurse in that facility. And so it's very important to think about how we de-identify our transcripts. If you are considering doing secondary analysis on a qualitative data set, it's really important to familiarize yourself with the whole study within which that data was used. So speaking with the primary researcher, in fact, in one paper I read, they say interview the primary researcher, understand, how and why the data was collected, what was the social context, what were the primary questions that were being asked, and drove the design of that study and the way that the data was collected. Were there any quantitative data collected at the same time? So often we do mixed methods research. So maybe there's also a survey that is important to understand the results of that, to understand the context of the data that you're looking at. In that sort of practical consideration, it's also important to consider that qualitative data is collected in a context, in a moment. So if you're looking at it 2-3 years down the line, or down whatever period of time, that context has changed. And so how are you interpreting that data now in a different context to what is there? So there are a lot of challenges and things that need to be considered if you're thinking about looking at qualitative secondary analysis of qualitative data. Sometimes being removed from data can be advantageous because you can have new perspectives on things, but it's really important just to bear in mind some of some of these issues and considerations if you're thinking of looking at qualitative data. So maybe I'll stop there. Those are just some to add on to what Sarah had said specifically with regards to qualitative data. And what I'll do is stop my spotlight and just open the floor for some discussion. And we've got some people on the line who I'm probably going to call on if there are questions that come up. We did have some questions that came forward when people registered, and so we do have a place to start from there. But maybe while people are putting some questions into the chat, I'll start with one of the questions that came up in our registration. And I'll first pose it to Sarah, and then I'd like to call on Professor Deb McFarlane, who I believe is on the line as well, maybe to add on after Sarah's commented. When analyzing secondary data, is it necessary to seek the approval of an ethics committee? So Sarah, I'll invite you to respond to that one first.
I think that, as with many things here, it's going to depend somewhat on context and what kind of secondary data we are looking at. So going back to the kind of funnel that I described before, if you are looking at something like census data, then it will likely, in a just solely census data, it may not be necessary to get ethical approval. But if you are looking at asking a different question than the one if you are looking at research data that was collected from another study, and you are looking at questions that are outside of the scope of what the original question was, and particularly if these are questions that may be particularly sensitive, or either because of the cultural context or because of the health information that's included, you may need to apply for ethical approval because especially depending on how the participants were consented, they may have said, oh yeah, you can share my information, but they may think, oh, it's only about this disease, or I'm only sharing it with this researcher. You may not think, oh, someone half a world away is going to ask a question about, I was being asked about my NTD status, and someone half a world away is asking questions about my blood pressure. And I didn't know that. So having that ethical guidance can be really helpful there when you're doing secondary analyses outside of the original scope.
Thank you. I think that's really important. What's the question you're asking of that data? I think is really important. Deb, perhaps you can comment as someone who's been teaching public health students for many, many years. Can you comment on ethical approvals for secondary data analysis? Whoops, you're muted. Sorry, Deb, go ahead.
You'd think I'd learn by now. Hi, Sarah, and thank you for some very important insights, as well as Alison. With respect to the question, we always say to our students that they must seek approval from our IRB in the form of a letter to the IRB that just says, this is what I'm planning to do. Am I exempt? And typically, yes, it's exempt. Now, that may seem like a lot of work for the IRB, but it's actually quite easy. But it puts in the brain of those who are using secondary data of any type that they have to think about the ethical implications. That's the first thing I would say, because I think if any of you are students, what one needs to do is get into the habit of always seeking IRB approval or ethical approval. And as Sarah and Alison have said, the requirements are different in each country. But if you are a Canadian researcher and using secondary data from Zambia, for example, I mean, you don't have to seek the IRB approval from Zambia, but you do for the university that in which you're enrolled. So if it's the University of Ottawa or Emory University, that would be the first thing I would say. So happy to respond to anything else, but that would be my initial comment. So thanks, Sarah and Alison.
Thanks, Deb. And I wonder, we've got Evelyn Aqua on from the University of Health and Allied Sciences, and I'd be interested, Evelyn, if in your perspective from UHAS, if you're able to comment, and then I see there's another question in the chat, but Evelyn, I'd invite you to comment as well, if you're there. I think you were there, and now I'm just wondering if you dropped off. Oh, maybe she's dropped off. Okay. That's unfortunate. Okay, I just sent her a message. So does anyone else want to comment on that from your perspective? You've heard kind of the Emory perspective and our perspective here in Canada, but it'd be interesting. I see Musa's online from Mali and Abdul. If there's any, it'd be great to hear from some of the others on the call in your institutions, if you follow a similar process for looking at secondary data analysis with your IRBs. Okay. Okay, so maybe while we're waiting, I think everyone I call, there we are. Okay, I was gonna say I thought we lost someone again. Okay, let's go to let's see, let's go to the question here in the chat. It is interesting to note, and I wonder if you want to comment also on your question, you feel free to unmute yourself. It's interesting to note that data can be identified. How can you identify such a respondent? Is there anything you want to add to that question? I just invite you to unmute yourself if you like. Yeah, go ahead.
Thank you very much, Alison.
Please introduce yourself, because I don't know who you are with your name there.
Okay, can you hear me?
Yes, please, go ahead.
Okay, so this is Grace, Grace Ajege. I work with Site Savers. Thank you very much for the insights that you've shared. I joined a bit late, but I got the part where we're talking about data protection, and then the additions you made about having to identify respondents. So you were talking about data protection, and I hope I got what you were saying correctly. You gave an instance of a situation where you are perhaps interviewing just one nurse in a facility. So if you even if you kind of code that person's name, it still comes to getting to know who that person is, because she probably is the only person working in that facility. So my question is, how do you kind of protect, you know, such a respondent? Just if you have any ways that we can keep that person from, you know, how do I say it now, like hiding or coding that person's identity?
Yeah, it's a great question, Grace. And I'll give you an example from some research that we've done, and we're about to submit the paper on it. And we interviewed people at it was a kind of a policy interview where we interviewed policymakers and donors and people working in programs. And that one's very risky, right? Because if I say I'm interviewing the NTD program manager from, you know, I'll take a country where we didn't go, to Brazil. Okay. There is only one NTD program manager from Brazil. So I can't really, you know, it's going to be challenging for me to, you know, I have to be very careful. And so what we did in that case was we actually said, these are the countries that we went to. So we listed all the countries where we went to. And then in the actual quotes, we said, you know, program manager from country A. And we did not link country A to Brazil. We just said program NTD, because it was important to understand that it was an NTD program manager, for example. That helped us to understand their perspective. But we absolutely had to be very careful and protective of their identity. And so we masked the country. So you can do that. You can say nurse from health facility in District A, you know, nurse from health facility in District B. It depends really on what's the point you want to come through, the location, you know, what's more, or is it in an urban environment or rural, or is it the role that person has within the health service, for example. So there's a few ways you could do it. That's what we did, was we actually just completely de-identified the country from the person's identity.
That's quite helpful. I think that was a smart thing you did.
I don't know. Yeah, go ahead. And I don't know if others on the call, there are lots of people with lots of experience on the call. So I'd be delighted to have you put your hand up and share some ways that you've also de-identified data, because it's a really great question, Grace, that you've given. And I know maybe while people are thinking of that, I know that there's also chances that you can take a sample of your transcripts. So, and I think that's what the task force requires, for example, is that you provide a completely de-identified transcript. So I think there's some examples maybe, and I don't know if Sarah or Beth, you want to comment on that, because I think that would be helpful. Maybe if there's some examples that people could look at to see what a completely de-identified transcript looks like.
Okay, thank you.
Yeah, I'm happy to speak to this a little bit. I think that this kind of draws in both the kind of how do you de-identify, and then Al's point of context and the importance of the original researcher's context for qualitative research. So our policy at NTD-SC/Core NTD, we have many names, is that generally for qualitative research, we will request that investigators share a transcript of each type that has been kind of de-identified in the way that Alison talked about. So say you did 3 focus group discussions and 8 key informant interviews. We'd say we would like one example of a focus group discussion and one example of a key informant interview. And we'd like them to be de-identified so that you can't tell who exactly is talking. So maybe in the case of the nurse in the district, you might say, if it's important that you know that that person is a nurse, you might keep nurse, but you use district A. Whereas if it's really important to know the location, you might say healthcare worker from X location. So hiding the part that is not as relevant to protect that participant's privacy. And then by only including one transcript of each type, it allows a potential researcher who would like to know more about a secondary user, who'd like to know more about this data and what was collected, see examples of what kind of data could be used, and then reach out and engage with the primary researcher Part of why we do this is that de-identification process, with quantitative research, you can apply certain rules and just the code and can be done very efficiently, but qualitative research is, what is the context of this? What information needs to be retained for it to be valuable? And it's a very time-consuming process to read through all those transcripts and do that. So by sharing some of the transcripts and other context about the study, it allows for a secondary researcher to know the data exists, to be able to find it, and then to be able to access it through the primary researcher. Hopefully that describes our process well, and I can try to find a link to an example during the next question.
Thank you so much, Sarah. Thank you.
Yeah.
That's very helpful.
Thanks, Grace. Thanks for your question. And we have a comment from Christiana here about seeking ethical approval and informed consent forms. So I believe, Christiana, you're referring to primary data collection here. And you're absolutely right that if you're collecting data for the first time, you need to have that informed consent and that ethical approval before you move forward. So I want to invite you to comment and make sure that I've understood your question correctly. Is that correct, Christiana? And feel free to unmute yourself. There you go. Go ahead.
Yes. Yes.
Okay, that's great. So I think, when you do secondary analysis, you don't need to do informed consent forms again, because the data has already been collected. And so what we're thinking about here is there's all kinds of ethics that are important for that primary data collection, that interface, that interaction between the researcher and the participant, or the interviewer and the participant. But once that data is already collected, there's other ethical issues and analysis considerations that we have to bear in mind. But it's really important for you to understand, if you're looking at secondary data analysis, how that process, how people were consented, how they were selected. It's important for you to understand that so that you can, it can play a role in your analysis as well. Jennifer, I saw you went off mute. Were you looking to make a comment? Not to call on, well, I am calling on you, but I saw you've just come off mute, and I don't know if that's, or maybe you're not. Okay, you don't have your sound on. Okay, go ahead. Oh, great. Thanks, David. Great question. Would you like to comment on this from University of Health and Allied Sciences in Ghana? And then Fodi, I see your hand, but let's go to David first. I'll invite you just to comment on your chat if you'd like, if you're able to. David.
I was asking if in taking this, David.
Hi, David.
In taking primary data, the researcher might not have your topic in mind or your title in mind. And so if I want to use someone else's data for another purpose and I realize it's not complete, would I take primary data and add to that for my purpose, or I would have to do only what I can with what is existing as the secondary data?
So if I understand you correctly, if you're looking at secondary data and you find that it doesn't answer all your questions and you need to go back and collect more data, that then becomes primary data collection, and you'd need new ethical approval and processes in order to do that. So it would have to be considered as a new study at that point, if I understand your question correctly. Sarah, do you want to comment on that at all?
Sure. I think that thinking really broadly about this, using secondary data and primary data together is something that we do a lot. We might use census data, but we are asking specific research questions. We might use data that's publicly available from the government. I think that if you're going to utilize it in a narrower, something from a research study and then secondary data from another research study, you do want to make sure that any data that you're collecting, it is clear kind of what the provenance is. Like, I can make these conclusions based off this data that I collected myself to answer this specific question, and I can infer from that secondary data perhaps some other things, but to make it clear to anyone consuming this research that there are different sources, because I think that is important in someone understanding what you have done and what conclusions you're drawing from it. That is my take. Alison, if that covers what you were thinking.
Yeah, that's a great point. Just clarity on that. Does that help, David?
It helps a lot. Thanks.
Great. I see Faudier has his hand up. Go ahead, Faudier. Over to you.
Okay, thank you. I'm gonna try to give the example we recently did in Mali when we worked on this research project for the World Bank. It was about result-based financing, where health facilities get paid when they get some kind of specific percentages for specific indicators. So when we started, it was pretty straightforward. We were planning to categorize our interviewees. For example, we were planning to say when we were coding, interview staff Minister of Health, interview local NGO or local partners, interview international partners. But by the end, we finished data collection. We only got one international partner. So it was pretty clear we couldn't say interview international partners. Everybody would know it was someone from UNFPA, and people would know who it was specifically. My point is, sometimes you can think about grouping or categorizing your interviewees, and then what we ended up doing, instead of having 3 categories, Minister of Health, international partners, and local partners, we had Minister of Health and supporting and implementing partners. So we put these international one international partners with local partners, and then that kind of solved our issue of de-identifying data. Even though sometimes it's very helpful to be able to see perspective from each category specifically, but sometimes you have to do a trade-off, and do some compromise to be able to align with the requirement of data de-identification in qualitative. Thank you.
Thanks, Faudier. That's a great example. And it's kind of being creative, I think, of how you want to categorize your based on the questions that you asked. So I think that's a really nice, clean example. Daniel, please feel free to unmute yourself, and if you're able, turn your camera on and share your thoughts.
Hey, hello everyone.
Hi, Daniel, welcome.
Yeah, Daniel speaking here. Yeah, so I just want to share my thoughts on seeking ethical approval and on secondary data for my organization, for my school. Some of my colleagues, while working, doing some secondary data analysis, they were asked to collect the ethical approval from the primary study, and then attached their ethical application. And then after the review, IRB were able to issue ethics waiver for them, for some of the data they needed to use for the analysis. And on the other hand, for the identification of participants in qualitative research, I recently carried out a qualitative research, and I interviewed a number of healthcare workers from a small facility. So during the transcription, we did the transcription verbatim, and we realized that the identification goes far more than just one level de-identification. So sometimes you have to de-identify the position, and also de-identify the location where that facility is. So that was where I got to learn that, okay, it's more than in terms of quantitative data, you just identify the name and the usual ones, but in qualitative research, you go further than that too. You try to, in a way, in the best possible way, hide the identity of the participants, so it cannot be traced at all. Yeah, that's my experience.
Yeah, and I think, Daniel, thank you for sharing. And what institution, or remind me what institution you're in?
I'm a tropical disease research fellow, master's research fellow at the University of Witwatersrand School of Public
That's
Health.
right. Okay, thank you for sharing that.
Yeah.
So I think you've raised, you've also raised a really good point is the different levels of de-identification that, we might just remove location, but if there's only 2 OB-GYNs in a region, just by saying OB-GYN in region, you're going to have a 50-50 chance of identification, or there's only 1 female OB-GYN in that region and you're going to identify her that way. So I think you're absolutely right. There are multiple layers that need to be brought into mind. I just wanted to ask a question related to costing data, because that came up in Sarah's presentation about sometimes we want to use secondary data for costing analysis. And Deb, just to bring you back on again, I wonder if you could comment on like the use of secondary data for costing studies, and if there are particular ethical considerations that we need to bear in mind for that, and are there approvals needed, or what are some of the considerations we may need to think about?
Right, thanks, Alison. I don't think costing data is any different than any other kind of data. So I don't think there are any unique characteristics of costing data. I mean, you're talking about costing data at different levels. And so whether you're looking at households, you would do the same kind of IRB that you would do, whether it's for secondary data that you do for any other kind of data, facility, donor. I mean, I don't think there is any unique aspect of cost data that requires any additional type of review. At least I've never experienced that. And I think the most important thing about cost data, for example, if you get Ministry of Finance, Ministry of Health data on financing, cost information, it's the understanding how that data were collected and who collected it. So if you're looking at national health insurance data, for example, again, you would have to go back and understand and really seek out how that data were collected, whether IRB approval was in fact needed or approved, and what's the status of that data in terms of availability. If it's open access, as Sarah has suggested, then okay. If it's facility level or household level, I don't think it's any different than any other survey data, but perhaps others have comments.
Thanks, Deb. That's Sarah, any additions on that with the costing? Thanks, Deb.
Yep.
Yeah, I think that I may have been a little unclear in my presentation. Part of the reason I brought up costing was not necessarily costing research, but the cost of performing the research.
Okay.
that there can be and I apologize for not being clear. Just the fact that it costs a lot of money to go out and do data collection. And so if you can reuse data that's been collected, that saves financial resources, human resources, and it asking a participant the same question repeatedly is not a good use of their time either. And so that kind of is cost efficiency in that.
Yeah. Yeah, thank you for that, Sarah. That's very important. It is expensive, as we all know, to collect data, whether it's on a community level or whether it's a national survey. And yes, that's always part of any proposal that we do or any type of work that we do. Was it going to cost to collect the data? We get excited about analyzing the data, but collecting it is a very costly proposition in many cases. So yes, always. That's not part of our discussion today, but it is helpful to acknowledge to those whose secondary data you're using that, yeah, you respect and are grateful and thankful for the work that they put in and the expense that they put in to collect the data. And just one last thing I would say that's important when you think about, quote, costing data is if you're doing a national survey or any other kind of survey of households, for example, the time that the head of household takes or any other member of the household takes is also an important consideration and often a cost that we don't take into account. Yet without them, we wouldn't have the data at all. And the opportunity cost for a DHIS survey, lots of those modules take a lot of time. So that's a bit off the point of our secondary data question today, but just one that I want to put in the minds of those who are on. Thanks.
Yeah, it's a very good point. We've got just a couple minutes left. I want to make sure that if you have any burning questions that you have a chance to put them in the chat. There is a question that came in before, which I think we can quickly address. Is a memorandum of understanding a must when sharing data? And so I would invite Sarah just to walk us through a little bit, like if someone accesses data on the core NTD site, what kind of happens? Is an MOU needed, or what kind of happens in the process?
Yeah, so I would say that it will depend broadly on your context, but in the example of the core NTD research dataverse, which I can put a link to in the chat, basically because of the way that we do de-identification and the level of data that is included, there are certain terms that one has to agree to in order to access the data. And the majority of these terms touch on some of the concepts that we talked about earlier, not re-identifying participants, giving the original authors of the data credit, those kinds of things. And you have, as a secondary user, you have to agree to those terms in order to access it. So it's not necessarily a memorandum of understanding per se, but this is where those other terms that I mentioned, a data use agreement, a data transfer agreement, a data sharing agreement, you often do put forth some kind of agreement between the person sharing and the person who will be using the data to govern kind of what are our rules of engagement. And this can be a pretty simple thing. For example, on the core NTD research dataverse, mostly a click through, yes, I agree to these terms. But if it's if it's a data set where de-identification was not possible, that will often become much more complicated, and it may be that you need both IRB review and a specific, some form of legal document that could be an MOU, but it could be data sharing agreement to govern, like, okay, ethics says we can share this, how are we actually going to do this, and what is the agreement between the parties? So very dependent on your source, but an important thing to keep in mind and to make sure that you, when you are using secondary data, that you do agree to the terms under which it was you were granted access.
Great. So I think we'll get close to wrapping up because we've got about 2 minutes left. So, but just to summarize, I think that we've really skimmed the surface on these issues, but I think what hopefully we've done is open your eyes to it's not just clicking on a button to access secondary data, that there are important considerations about what you agree to in terms of what Sarah was just referring to, the terms of reference from the holder of that secondary data. There's also, depending on what kind of data it is, a real relationship with the primary researcher to understand how that data was collected, the context, and that's particularly going to be important in qualitative and social cultural data that you need to really understand how the context is embedded in the data and the data is embedded in the context. So that relationship with that primary researcher is going to be particularly important there. And then hopefully we've also given you some considerations about analysis and what you want to bear in mind as you think about how you want to use that, and also when and how ethical approval is needed. And some of that is going to be dependent on your institution, the country you're sitting in, and the laws that govern and the kind of data that you're accessing. So you do need, if you're going to use secondary data, it's a good thing to do. We encourage it for all the reasons that Sarah mentioned and Deb mentioned. but please do bear in mind the various considerations that you need to bring together. So with that, I'll hand over to Rachel. We will be posting some relevant papers for you, and there are more questions. Please feel free to continue this as an interactive discussion. We're very happy to do another session if this is something people want more information in. So don't hesitate to continue to reach out to ICORDS if this is an area where we need to do more. Over to you, Rachel. Thanks.
Thank you,
Sarah.
Alison. And thank you everybody for joining us today. I'm launching a poll as we speak just to gain some feedback about today's session. And to quickly answer Grace's question in the chat, Grace, we try to do a monthly knowledge cafe every month. So you can also sign up. I put the ICORDS website there at the top, but the best way to hear about them is by joining as a member. We send out emails to let everybody know each month what our knowledge cafe is about. And also just quickly, ICORDS is currently asking for new steering committee members. So I'll put the link to the information in the chat here. So if you're interested in applying to be part of the ICORDS steering committee, we are opening a call for applicants now. So thank you, everybody. I won't hold you any longer. And yes, we do record, and I'll be posting it on our website. All right. Have a good day, everybody.